Well, who needs a stress test? That's a great question that patients often ask. And it really depends on the clinical scenario of the patient. If someone's having symptoms that might be suggestive of heart disease, we may order that stress test to see if their symptoms really correlate with significant blockages. Deciding who needs a stress test when it's needed is a very individualized decision that the physician makes with the patient. I do want to stress, though, that patients often think if they have a normal stress test, they're safe and it's like a warranty or an insurance policy, and that's not the case. A stress test only signifies significant blockage at the time of the stress test. And so you could have a normal stress test and have a heart attack at a later date, the next day, a few months later. It just depends on what's going on with your heart muscle and why the heart attack happened, what's causing the heart attack. So to think that a normal stress test is good is not the case. I always tell my patients a stress test is great, that it's normal, it tells me what's going on right now is okay, but you still have to do all the heart disease prevention tips that I advise them on, of no smoking, making sure your blood pressure is good, making sure your cholesterol is good, making sure you're eating the right foods, making sure you're exercising and you're working on your weight.